Every morning, millions of people swallow a tiny white pill called Amlodipine to keep their blood pressure in check. Doctors prescribe it to relax the arteries and prevent heart attacks and strokes. But here's the shocking truth. What's meant to protect your heart might also be silently harming your body. Many patients begin to notice strange changes: swelling in the feet, dizziness, fatigue, or even chest discomfort. They often think it's just aging or stress, but it could be the pill itself. Studies have shown that long-term amlodipine use can trigger several severe side effects if ignored. Sadly, most people don't realize this until it's too late. In today's video, we'll uncover 6 dangerous side effects of amlodipine you should never overlook, and what you can do to protect yourself naturally. By the end, you'll understand exactly what's happening inside your body and how to take action before it's too late. So, if you or someone you love takes amlodipine daily, watch closely. This information could literally save your life. Let's begin with the first major side effect: ankle and leg swelling, also called edema. This is the most common warning sign that something isn't right. Amlodipine works by relaxing blood vessels, allowing blood to flow easily. But in doing so, it also allows fluid to leak into tissues, especially in the legs and feet. That's why many users notice their shoes getting tighter or ankles puffing up. Ignoring this can lead to long-term circulation problems and even vein damage. If you notice swelling, elevate your legs when resting, reduce sodium, and discuss with your doctor. Your dosage may need adjusting. The second hidden danger is dizziness and lightheadedness. Because amlodipine lowers blood pressure, it can sometimes drop it too low, especially in older adults. When that happens, blood flow to the brain temporarily decreases, causing you to feel faint. If you suddenly stand up and your vision blurs, that's your body signaling imbalance. This side effect increases fall risk in seniors, leading to serious injuries. Always get up slowly, stay hydrated, and monitor your blood pressure regularly. Next, we move to heart palpitations and irregular rhythms. This one often shocks patients because they assume blood pressure medicine can't affect the heart's rhythm. But amlodipine can, in rare cases, cause rapid heartbeat, fluttering sensations, or chest discomfort. The reason is that your heart compensates for relaxed arteries by pumping harder. If you ever feel pounding in your chest or skipped beats, never ignore it. Get checked immediately, as this can indicate arrhythmia or heart strain. The fourth effect is severe fatigue or weakness. Many people report feeling unusually tired after starting amlodipine. The drug slows your vascular resistance, which means your blood pressure stays low, but that also reduces oxygen delivery to muscles. Over time, this constant low pressure can make you feel drained, unmotivated, and even depressed. Don't mistake this as simple aging fatigue. It could be your body's reaction to medication overload. Eating magnesium-rich foods like spinach almonds and pumpkin seeds may help restore energy naturally. Now comes one that few talk about: gum overgrowth, known as gingival hyperplasia. Amlodipine can cause your gum tissue to thicken and grow over your teeth, leading to infections or difficulty cleaning. It happens because the medication alters calcium levels in gum cells. This is more common with long-term use and poor oral hygiene. Brushing regularly, massaging gums, and visiting your dentist can help prevent this. If your gums start changing shape or bleeding more often, tell your doctor immediately. The sixth and, maybe the most emotionally distressing effect is sexual dysfunction. Amlodipine may reduce blood flow to certain organs, lowering libido or causing erectile issues in men and arousal problems in women. This side effect is rarely discussed in clinics, but it deeply affects quality of life and relationships. It's not in your head. It's your circulation being affected. Some studies show that switching to alternative blood pressure medications or adding natural vasodilators like beet juice or L-arginine, of course with your doctor's guidance, can restore performance. Besides these 6 main effects, long-term amlodipine use can occasionally cause flushing headaches, constipation, or weight gain. All these happen because your blood vessels are forced to stay in a dilated state for extended periods. Think of it as your cardiovascular system being, well, over-relaxed. The key is awareness. Recognizing these signals early gives you control before complications escalate. Now, what should you never do? Don't stop amlodipine suddenly. Stopping it without medical advice can cause a dangerous rebound. Your blood pressure may shoot up rapidly, risking a stroke or heart attack. Instead, talk to your doctor about tapering options or complementary natural therapies that can support your blood pressure safely. For example, magnesium helps relax vessels naturally, potassium balances sodium levels, and omega-3 fatty acids reduce inflammation. Daily walking, proper hydration, and a low-sodium diet are your best allies. All right, let's recap briefly. Swelling, well, that means fluid retention. Dizziness, on the other hand, indicates low blood flow to your brain. Heart palpitations? That's rhythm stress. Fatigue suggests an oxygen imbalance. Changes in your gums point to calcium disruption. And low libido? That's often a sign of poor circulation. Each of these is your body's warning alarm. So, listen to it before it's too late. So, what can you do now? The first step is awareness. If you're experiencing any of these side effects, don't panic. But hey, don't ignore them either. Keep a daily journal of your symptoms, blood pressure readings, and energy levels. And share it with your healthcare provider. Ask about dose adjustments, or if another calcium channel blocker or combination therapy might suit you better. Remember, your health is a partnership, not just a one-way prescription. If you want to take control naturally, begin by strengthening your heart through food and lifestyle. Eat potassium-rich fruits like bananas, oranges, and avocados. Cut down on processed foods and excess salt. Drink beetroot juice in moderation. It naturally widens blood vessels. Add magnesium-rich greens and omega-3 sources like walnuts or fish oil. Move your body every day. Even gentle walking improves circulation and reduces swelling. And above all, stay hydrated. Dehydration amplifies medicine side effects. Finally, understand this truth. Medicine can manage symptoms, but healing comes from balance. Amlodipine is not evil, but long-term use without awareness can cause harm. The goal isn't to fear it, but to respect it. Be informed, be cautious, and work with your doctor to find the lowest effective dose possible. When you combine knowledge, mindfulness, and lifestyle strength, you protect your heart and your future. Remember, awareness is the best medicine, and your body is always speaking. Listen carefully.